Hello.
Hi.
Okay, so class, today I have with me my Aunt Danielle, and she is a sports medicine doctor from New York, like I told you guys. So she's going to be answering some questions about the body and some of the things she does on an everyday basis. So, first question, what do you do for your job, and what's your favorite thing?
Hi, Mrs. Lee. Thanks for
Hi.
having me today. So, can you ask the question? I'm sorry, I totally missed it.
It's okay. So, what are some types of things that you do as a sports medicine doctor?
So, when I go to work, I have the pleasure of seeing athletes that are young as 5 years old, all the way up to 100 years old.
Wow.
So, I take care of all parts of the body. So, right from the neck all the way down to the ankle. And I help patients to feel better so that they can play sports or play with their grandkids.
Awesome. That's great. So, they don't have to be an athlete to go to a sports medicine doctor.
No, because things as simple as picking up groceries can be perceived as an athletic event for some people who are, a little bit older.
Right. Perfect. All right. So, Dr. DiGiorgio, we have been learning all about the body. And yesterday we talked about different muscle groups. And so I have a couple of questions for you because today we're learning about joints. So
it's a great topic. I love joints.
So first tell us, what is a joint?
So a joint is where two bones come together to give you mobility and stability, meaning they can move, but they're strong enough to withstand some pressure.
Awesome. And so a joint, you can find that on what parts of the body? Where's the joint?
Basically everywhere. So in your neck, in your shoulder, in your collarbone or your clavicle, anywhere where two bones meet is considered a joint.
Wow.
We have a lot of them in our wrists.
That's cool. So can you feel the joints, or do you feel like it's probably more on the inside?
Yeah, so some joints are really superficial or close to the skin. So if you put your finger pretty hard into the area where it bends and flexes, you can actually feel the joint.
Cool.
And you can feel it also, but some joints are really deep, like the hip, so you can't really feel how the motion is.
Gotcha. Cool. So the next question we have, what is a ligament? So we have all these vocabulary words.
Yes. So ligaments are a pretty strong structure. It's kind of like a rubber band, and its job is to support the connection between two bones. So if two bones are like this and they're separate, if you don't put any structures between them to keep them together, they're going to move all around and won't be very strong at all. Have these things called ligaments that are like really strong rubber bands, and they hold those joints together so that way they have stability when they move. Whether they're different types of joints, will have stability in their motion.
Cool. That's really awesome. So the ligament really helps make it strong. So that's awesome. So then my next question, I'm just looking at my phone with my questions. How, you already said how joints and ligaments work together. So now, what is a pivot joint?
Oh, pivot joints are fun. So pivot joints allow for a motion of rotation between two bones. So there's a lot of different ways that two bones, when they meet, can move. So an example of a pivot joint would be the neck, because I'm looking straight ahead, but now I can turn from side to side. So that is a pivot joint because bones are stacked on top of each other and they're rotating like this. And that's their freedom of motion.
Cool. That's awesome. So ligaments help with that too then, right? Because every joint has ligaments attached, so that helps in their movement as well.
Yep. And what's really neat is that based on how the joints are able to move is how those ligaments are structured on certain sides to give you mobility. So we can move our neck from side to side, but we can also move our neck from front to back.
Right.
So those ligaments are very specifically placed in an area so that way you can allow those motions but still have stability. Otherwise, your head would just fall down.
Yeah, and that would be awkward to just stand like this.
It certainly would.
Okay, and I have two more joint questions.
Sure.
Okay, what is a hinge joint?
So a hinge joint is also very fun. So a very simple example of a hinge joint is your finger joints. Notice they move in this plane, but they don't really move like this. It will be weird.
Oh.
And that's because you have ligaments on either side that work to hold them stable, the bones from shifting side to side,
Cool.
but not this way, so that way it can bend nice like this.
Oh, wow. That's really cool, class. So if you try to move your finger, it doesn't really move that way, right? So then if you move it, it could go like this, but she's saying you would have to really, really push hard and it wouldn't.
Right. So just to make a little bit more sense, we can move our fingers like this, but the bones that are connecting, because there's multiple bones in the finger, they don't move like that.
Right.
Right?
Yes. Awesome. And so then the last one, which I feel like is pretty cool too, is the ball and socket joint. So tell us about that.
So a ball and socket joint, we have a few in the body. The most common ones that we talk about are the shoulder joint and the hip joint. Now, what makes a ball and socket joint really unique is that it's created so that way the ball can rotate many, many planes and give us a lot of motion. So you can take your shoulder, you can bring it up this way, you can bring it behind your back, you can bring it out to the side, you can bring it across. And so that joint is really special because there's a lot of ligaments, but they all pull equally on it to hold it suction cup into the socket. And so you get a lot of motion, but also if it's not properly taken care of, it can actually lead to a lot of injuries.
Wow. And so do you see a lot of injuries in the ball and socket joint on like a regular basis?
Yes, it's very, very common because that increased mobility or movement then leads to a really big risk because the stability is not there, meaning it because it has that motion, it's very predisposed to injury. So I see this very commonly in my throwing athletes, right? Because this is not a very normal motion, but there's a lot of work that goes through the shoulder here. And so I see a lot of people or lifting heavy objects, my construction athletes, right? They're lifting a lot of heavy objects over their head, or painters who are doing a lot of repetitive motion like this.
Yeah.
Very, very common.
So a lot of my students are athletes. And so, so for them, what is a way to help these joints in not getting injured? What can they do as they grow in their athletic abilities?
Yeah, so I love sports and they're so healthy for you as long as you do them, not all the time. It's very important to play a lot of different sports. Even if you have one that you really love to play all the time, you really should try to do a couple of different sports because they actually make you better at one sport.
Wow.
I recommend you play at least 3 sports. And when you're outside playing, just enjoy playing because the benefits of exercise are way beyond just being a good athlete. It helps your heart, it helps your lungs, it actually helps you think better, makes you a better student. So
Yeah.
like that. So it's very, very important to exercise and to keep your body healthy. The more you do it, actually, the better you're going to be, the stronger you're going to get.
That's awesome. Well, thank you so much for doing this interview with me, Dr. DiGiorgio and Danielle. And yeah, class, so if you want to also send me any questions that you have and I can ask my aunt anytime. Because a lot of you, again, play a lot of sports. We have a lot of golfers, baseball players, dancers. So a lot of them are always moving, basketball, softball, all over the board. So if you have any questions, let me know and I can ask my aunt too. And Aunt Danielle, thank you so much for being here. And
it was my pleasure.
And hopefully we will talk soon.
Sounds great. Have a great time, boys and girls.
Okay. Bye.